Hi, this will be a very short video, but at the same time, a very important one because this is about the RAAS mechanism, the RAAS mechanism, the renin angiotensin aldosterone system. Okay, so why do I tell you that this system is very important? Because you'll be encountering this mechanism till the end of med school. Like I'm in third year now, so I'm encountering it still in my third year in pedia, in internal medicine, and wherever I go, this RAS mechanism is involved in one or the other way. That's how significant it is. So in this video, we'll see from a clinical perspective where you should be applying this system, what makes sense about applying this system, and what really happens, and what are all the pharmacotherapeutic ideas formed behind this system. Okay, formed using this system. So the clinical picture here is the RAS system usually gets activated when the blood pressure in the body becomes low. Okay. So let's take what are all the cases in which a patient can have less or a low blood pressure. When the patient has hypotension, which is less blood pressure. Or let's say the patient has an internal bleeding, a hemorrhage. That leads to hypovolemia because there's loss of blood, right? As a result, there is hypovolemia, and again, as a result, there is hypotension. Let's say the patient is severely dehydrated, in which the blood volume or the volume of water in the blood vessels is less. So again, there is hypovolemia and hypotension. Let's say there is renal artery stenosis. So that means enough blood is not reaching the kidneys, enough blood is not getting filtered. Let's take cardiac failure. In cardiac failure, the heart is not able to pump blood, it's not able to meet the cardiac output, the demands of the body. As a result, there is less blood sent across the body. As a result, there is hypovolemia and again hypotension. In cases like hyponatremia and hyperkalemia, you all should by now should know that sodium will always be followed by water. I mean, water will always follow sodium wherever it goes. So, if the blood has less sodium, that means there is less water in the blood. So, hyponatremia can cause less water in the blood, which is called hypovolemia, once again causing your hypotension, which is your low BP. And similarly for hyperkalemia, which usually happens when there is hyponatremia. Okay, so these are all the factors that causes decrease in blood pressure. So when there is decrease in blood pressure, then that activates RAAS mechanism for the long term picture. For the short term picture, usually it's the baroreceptor reflex. So what's baroreceptor reflex? So there are pressure sensors in our body that send signals to our brain that the pressure is low or high, and it alters the blood pressure by constricting the blood vessels. But this is for short term. Okay, this is for very short term, and it does not be effective for a long time. But when you take RAAS, the RAS mechanism, this is for long term maintenance of your blood pressure. Okay, so as I said, now you must understand where this RAS mechanism comes into play. When the patient presents with all of these following things, you can imagine, you can visualize that the RAS mechanism will be activated in the patient. If not, then there's a problem. Okay. So where does this RAS system start? Where does the mechanism start? It starts from a region in your kidney, specifically in your nephron, even more specifically near the afferent arteriole. So near the afferent arteriole, there is a group of cells called juxtaglomerular cells. These juxtaglomerular cells produce a substance called renin. Okay. Now let's see, what does this renin do? So renin, what it does is it converts angiotensinogen into angiotensin 1. Now what is angiotensinogen? It is a protein produced by your liver. Okay. So angiotensinogen is converted into angiotensin 1. Now angiotensin 1 is converted into angiotensin 2 in the presence of an enzyme called angiotensin converting enzyme ACE, which is produced by your lungs and your kidney. Okay, so angiotensinogen is produced by the liver and ACE is produced by your lung and kidney. So now that angiotensin 1 is converted into angiotensin 2 is going to activate aldosterone, produce vasoconstriction, promote the secretion of ADH from posterior pituitary, and increase thirst by acting on the hypothalamus. So what happens? Angiotensin 2 is going to go and act on your adrenal cortex to produce your aldosterone, and it's going to cause systemic vasoconstriction, and it is going to stimulate your posterior pituitary to produce ADH. or a vasopressin, which decreases the loss of water, and it's going to act on your hypothalamus in your thirst centers to increase thirst. So what does all these things do? All these things, they try to increase volume of your blood. So what does aldosterone do? Aldosterone increases sodium reabsorption. So if sodium is reabsorbed more, there is more water along with sodium, as you know. Vasoconstriction increases the blood pressure. ADH again increases water. It avoids water loss. And thirst, you increase water intake. Okay. As a result, all of this will counteract your hypovolemia, and the volume of the intravascular space increases. So as a result, you have the maintenance of your blood pressure. So there are two types of angiotensin receptors which you should know about: angiotensin receptor 1 and angiotensin receptor 2. So usually angiotensin receptor 1, once it gets acted upon by angiotensin 2, and it releases phospholipase C, and that's how it causes its desired actions. Angiotensin 2 acts through the CGMP mechanism. Okay, so angiotensin 1 is present in your arteries and adrenal cortex, whereas angiotensin 2 is usually present in your fetuses and neonates, but all studies also say that it's present in brain. Okay. Now, the angiotensin 1 can be subdivided into two more classes: angiotensin 1A and angiotensin 1B receptors. Angiotensin 1A is present in your blood vessels, brain. Angiotensin 1B is present in your adrenal cortex and anterior pituitary. Okay, so adrenal cortex, if it's going to act on adrenal cortex, remember it's going to secrete aldosterone. So that's angiotensin 1B receptor. And if it's going to act on anterior pituitary, accordingly. So that's what I said here. Aldosterone, it increases sodium reabsorption. Okay, if sodium is reabsorbed more, there is increase in water. Okay, so there is compensation for the hypovolemia. As a result, there is increase in blood pressure. So again, ADH increases water. You have increase in water intake because angiotensin 2 acts on your hypothalamic centers and increases thirst. And obviously you have your vasoconstriction too, which increases your blood pressure. So this is what renin angiotensin aldosterone mechanism is. It is very crucial to understand this mechanism by heart, or let's say by the mechanism, and by what stimulates this mechanism to take place in the start. Okay, you should remember the triggering factors which you can apply clinically. All these factors. Now, based on this, there are some pharmacotherapeutic agents. Now, what does this entire mechanism do? It increases blood pressure, right? But if blood pressure becomes too much, you see that in patients with hypertension, you can use drugs that inhibit this pathway. Okay, so for that you have your ACE inhibitor drugs and angiotensin receptor blockers. So ACE inhibitor drugs usually block this. As a result, this doesn't happen. As a result, blood pressure doesn't increase. Once again, this is for hypertensive patients. ARBs, they block the angiotensin receptors that we talked about. As a result, angiotensin cannot show its actions, and as a result, the patient can see some relief from their hypertensive crisis. Okay, so ACE inhibitor examples are your pril drugs, captopril, enalapril, and ARBs, angiotensin receptor blockers, are sartans, losartan, valsartan. So to summarize, you must remember this pathway, what all angiotensin 2 does, and you should understand why this renin angiotensin aldosterone pathway exists. It is to compensate for these things that happens to a patient. Okay, these are the triggering factors that causes decrease in BP that activates your renin angiotensin system. Okay, that's all for this video. Thank you.